Hi, good evening. My name is Linda Okafor. I have been a nurse for about 25 years, and during this period, I've had encounters with people suffering mental health disorders, especially when I worked in the skilled nursing facility and when I worked with people with end-stage renal disease. In both encounters, I do not have any control over their cares. Instead, if the patient presents with agitation of sudden onset, I will collect urine samples to check for urinary tract infection and other signs of infection in the patient, especially in the elderly patients. If the patient has a history of Alzheimer's or dementia, I will give them their as needed medication for agitation. However, my most recent experience was a 56-year-old male with severe mental illness who was admitted into a medical group home that I manage. He had a traumatic brain injury when he was about 17 years old that resulted in mental retardation. Somehow, I have some control over his care, but not as a mental health provider. It was pretty challenging at first to understand his triggers and how to prevent sudden outbursts of anger and physical abuse on the people around him. However, we later developed a behavioral treatment plan that helped tremendously to reduce the triggers. Also, we worked closely with his mental health provider for medication management and psychotherapy. The population I currently work with are people with developmental disability. I find working with this vulnerable group very rewarding. Working with them requires much patience and love to understand them and their triggers. Once the provider identifies those precursors to their behavior, it is easier to redirect them to alternate positive behaviors. I started my clinical rotation this Monday, and I love the experience so far. However, I am currently going through a challenging time in my personal life that made it easier for me to relate with patients who present with similar situations. One concern that I have is figuring out how to take charge of the interview. Some patients will come in with many issues they want to discuss, and they will start talking as soon as they sit down. I am impressed at how my preceptor redirects them and take control of the room, and before long, the situation is under control. I mentioned this concern to my preceptor, who told me this skill comes with practice. She informed me that she felt overwhelmed when she first started. Some personal and academic goals for these clinical rotations are: 1, to improve my practical skill by reviewing patients' cases and carefully examining them. 2, I will increase the number of clinical hours each week so that by the end of the 9th week, I will have 130 field encounters. 3, I want to enrich my psychotherapy skill, learn how to engage the patient in an interview, and have a positive outcome at the end of the visit. 4, practice self-care to prevent mental and physical breakdown while taking this course. And number 5, I must learn to balance work, home life, and schoolwork so that I do not neglect my role as a wife, mother, employee, and student. Thank you very much.